majority of what happens in the brain, again, this has been occurring in neuroscience research, the vast majority of what happens in the brain, we never become conscious of.
And I'm guessing with what you and Todd have talked about is that although it is unconscious, that we can recognize it through our behavior. So when we recognize it through our behavior and then we shift the behavior, then we go back and create a healthier loop.
Absolutely, yeah. Well, we can make people conscious of what they're doing, and so you can become conscious of what was previously unconscious. And so once you become conscious of these patterns, the thing about addictive patterns is they're completely irrational. Like it never makes any sense. There's never any good reason to cause yourself unnecessary pain or unnecessary emotional distress or to be in a relationship that's a terrible relationship that just causes you pain. And so once we make people conscious of what they're doing and how these patterns are driven, then they can, just by recognizing that immediately starts to change your brain, starts to change that network. And then the more your behavior starts to match that consciousness, then your brain changes even more, and those healthy circuits become more and more reinforced, and the unhealthy circuits become more and more broken down.
Amazing. Todd, would you
like
to add?
And there's a way to really speed up. We always go for a best case scenario, and there's a term that we use called spontaneous recovery that is our ultimate goal, which of course we don't achieve in most of the cases. But really what we're trying to do is that consciousness is part of the recovery process. But if you have consciousness and some level of consciousness, but it's not really connected to any real sense of pain, then I may not have enough pain related to my behavior, enough awareness related to my behavior that creates enough consciousness to really give me the impetus and drive to change in a more expeditious manner. But if my consciousness also reveals to me the full cost of my behavior, and that if in a single moment I can no longer, the veil of denial and justifications are removed, and I see the full impact on my life, my experience, my relationships, my love, my career, my creativity, my overall happiness. If I really am brave enough and courageous enough to take a really good look at that, then I potentially can literally put that behavior down in an instant, in a moment. It might just be one addiction or one alter that you're addressing in that moment, but you might be done with it for the rest of your life.
مسئله مهمی که میفرمایند اینه که ممکنه که یک رفتار به خصوصی اونقدر درد به خصوصی نداشته باشه و دردناک نباشه در اون لحظه که در بدن ما اون درد احساس بشه، حالا چه درد جسمانی میگیم چه درد احساسی داریم و روانی داریم میگیم، ممکنه اون رو به اندازه کافی نداشته باشه که اون انگیزه رو به وجود بیاره که تغییر بدیم. ولی صحبت جالبی که میکردن اینه که وقتی که ما نگاه میکنیم به پیامدهایی که باید داده بشه و به بهایی که باید داده بشه، از دست دادن عشقمون، از دست دادن دوستانمون، از دست دادن کسانی که اطراف ما هستن، از دست دادن‌های بسیار زیاد، اون موقع ممکنه اون خودش یک انگیزه‌ای بشه که ما رو به طرف این ببره که اون نوع رفتارهای به خصوص رو کنار بگذاریم و بریم به یک فضای رفتارهای سالمتری که ما رو به جایگاه تعادل در حقیقت میاره. اگر بتونیم سلاید بعدی رو داشته باشیم که there you go.
Okay, yeah, well, this is just, excuse me, this just sort of shows that, sort of what I was saying before, that there are all these studies from neuroscience, from brain imaging studies that show that various kinds of pleasure release beta endorphin in the brain and activate the reward areas, the reward system, and release beta endorphin. So like eating, having sex, looking at beautiful faces, receiving money, listening to especially pleasing music, like whenever we listen to music and you get the feeling of chills, the feeling of those feelings of chills are because of the release of beta endorphin. So if you block beta endorphin release in the brain, you don't get chills anymore when you listen to your favorite song, your favorite music, and so yeah, and then if you want to show if you can go to the next slide actually.
سلاید بعدی را مگه بتونیم داشته باشیم؟
I'll have to learn that at least in Farsi. Go to the next slide.
Slide بعد.
But there's also a lot of evidence, especially over the past 5 years, that a lot of painful and distressing states also activate the reward system and also release beta endorphin in reward areas. And and again, no one has ever really. So for example, brain imaging studies have shown that when people have sustained pain in a jaw muscle or have burns or electric shocks, all of these things can release a huge amount of beta endorphin in the brain and activate reward areas. Or another brain imaging study showed that just by people who are chronically depressed, who are seriously depressed, if they're asked to think of a painful thought, just something about say an old relationship, somebody who they were hurt by, just that thought itself releases beta endorphin in their brains. And so, in other words, just by a distressing, painful thought, you get a payoff from that. You get an unconscious payoff in your brain from it.
And I know that in a psychotherapy, as Todd was talking about, a lot of times we do talk about payoffs, but I do get it that most of us keep looking at psychological payoffs, and many times as we're exploring it with the clients, they're like, well, what do you mean? This is painful. Why am I getting a payoff? This is not the truth. I'm not getting payoff. But we're looking at, well, we are. It's just a biochemical payoff.
Well, it's unconscious.
It's an unconscious biochemical payoff rather than somebody really consciously looking at people really getting rewards from it. Because when you talk about payoffs, many people translate it into something that is pleasurable.
Right.
And then if consciously they can't, their brain can't kind of turn around it and put it and call it and give it a meaning of pleasure, then they dismiss it that this is not rewarding. But however, internally it is rewarding because the brain function and the biochemicals in the brain are giving it another kind of a reward.
Yeah, well, this is a very clear explanation for what the payoff is, and it sort of relates the brain anatomy with why the payoff is unconscious. But yes. The thing is that the interesting thing is that once you become conscious of what you do to create pain in yourself and chaos in your life and drama in your life, you can become conscious that you're getting a reward from it. That's the cool thing. Like once you see what's going on, it's actually easy to see in other people sometimes. Like we all know somebody who just seems to love being miserable. And they don't really love it.
I know a lot of them in my practice.
Yeah, but they're getting something out of it. They're getting a payoff from it. And this is sort of a very clear explanation for what's happening. We find that just the clarity of it, that we have this sort of biochemical substrate for it, just seems to help people overcome the patterns. They can just see it more clearly. It's more obvious.
Yeah. Todd?
It also makes a lot of my clients more amenable to therapy. To know that, to tell somebody that you're getting a payoff from your behavior, and lots of times, if they don't know that it's actually a biochemical payoff, and you're trying to convince them that there's a payoff to some sort of destructive behavior, oftentimes they can feel broken, they can feel angry, they might shut down and not even open up to therapy.
Right.
But when they realize, well, maybe we don't have an obvious behavioral or psychological payoff, but that in fact the payoff that we might only be talking about is just that you get this biochemical payoff in the brain that continues to drive the behavior. It somehow puts people at ease and makes them more open and accessible.
Yeah, it's sort of like a trick. It's an illusion that happens in the brain. It's nothing that you would ever. It doesn't make sense to judge anyone for it because it's something that just happens unconsciously. It's like you fall into this illusion. And that's what we do is we try to give people the consciousness so they can see through the illusion.
خیلی موقع میفرمایند که ما برچسب‌هایی میزنیم به خودمون و اشخاصی که رفتارهای ممکنه ناهنجار داشته باشن یا اعتیادگونه داشته باشن و این برچسب‌ها رو در حقیقت علم داره برمی‌داره و اون فضای اینه که یک نفر بیماره یا مریضه یا درد داره یا یک چیزیش هست که این کارها رو داره انجام میده رو داره برمی‌داره و نگاه می‌کنیم به اینه که همه ماها یک سری همونطور که برین ایمیجرها رو داشتن نشون میدادن نگاه میکنیم به اینی که اون قسمتی از مغز ما که لذت رو داره و درد رو داره همونقدر چیزای بیوشیمی میفرسته در کنار، یعنی همون که اگر شما روابط جنسی دارین، غذای خوشمزه میخورید یا جای خیلی زیبایی هستید، همونقدر دارین کیف میکنید که اگر افسرده هستید و یا ممکنه